$10 billion from the recently passed stimulus package will help pay for COVID-19 testing in schools. The Biden administration announced that local health departments will get the funding in early April as part of its effort to open schools around the country safely. So we want to bring in Dr. Leo Nissola. He's a physician and immunotherapy specialist. Dr. Nissola, so in your opinion, just how much screening do schools need to do to keep this virus from spreading?
Well, a lot of screening. I think increasing the testing protocols is part of President Biden's effort to help schools reopen safely. They will spend, as you said, billions of dollars to scale up testing in underserved populations and provide some guidance on the asymptomatic screening that needs to occur in schools to protect teachers and school essential workers. I think this is an important issue because the safety of our teachers, the safety of our essential workers will depend on three things: vaccinations, testing protocols, and safety protocols in those schools. So this is exactly what it needs to be done right now.
Doctor, as you know, New York Governor Andrew Cuomo got the Johnson & Johnson vaccine yesterday, but there have been reports of vaccine hesitancy, especially when it comes to that specific shot. Can you explain how this shot is different from the Moderna and the Pfizer vaccines and why the 66% efficacy rate from the clinical trials could actually be misleading?
That's right. Well, let me be clear. All three vaccines approved under the emergency use authorization are 100% effective in preventing deaths. That's what matters. In an unprecedented timeline, drug makers and federal agencies were able to produce these safe and effective coronavirus vaccines in record time. Since the outbreak was first identified, an unprecedented amount of work has happened to get us the vaccines that we have today. And that includes clinical trial volunteers that have tested in the United States these vaccines in order for us to understand if they were safe and effective, and they were. In clinical studies, as you mentioned, J&J's vaccine had a 66 effective percentage to prevent moderate and severe cases, while compared to the 95% of Moderna's and Pfizer's. But all of them prevent deaths. And I think we should focus on preventing new hospitalizations, preventing new deaths. And that's what these vaccines are doing for us.
California has recently lifted some of its COVID restrictions. And this week, the CDC named the two virus variants that turned up in California variants of concern. That's what they called them. What do we know about these strains? And are you concerned about a possible uptick in cases?
Well, preliminary research has shown that this variant in California seems to be at least 20% more transmissible. We are monitoring these mutations and these variants closely, but no coronavirus variants at this time are at the highest threat level where we think it might escape immune response. And let's try to make sure that we don't create new variants by slowing the spread of this virus. And the only way that we can do this is by increasing our testing efforts, increasing our immunization efforts, and avoiding new cases. So easing restrictions like we have seen in New York didn't play as well. The variants are all over New York, including new mutations. The 1526 variant is one that is concerning to me. It's increasing across the state of New York. About half of the 1526 cases being found there have this 484K mutation, which is a mutation that we are looking closely to understand if the vaccines will actually be covered under this new mutation. So reopening indoors in New York was a mistake. The majority of people are not yet vaccinated, and a more infectious variant will likely lead to more infections and eventually new variants. So it's exactly what we want to avoid.
So at a hearing on Capitol Hill yesterday, one lawmaker asked Dr. Fauci about the effects of the COVID-19 vaccine and what the effect could be on people suffering from long haul, what some people have called long haul COVID. Some people have reported that the symptoms linger, that their symptoms linger, but they've also improved after the shot. Can the shot have the opposite effect?
So researchers, scientists, drug makers, regulators, and public health officials are all trying to understand right now whether or not vaccines can have an effect on long hauler syndrome and long COVID, or not. But it's still too early to be certain of that. Right now, we expect that at least 10% of COVID cases in the United States will lead to a severe long-term infection, which is concerning from a public health perspective. Well, that said, it's important to understand that the current vaccines that we have right now have not tested whether or not the long hauler syndrome will be have any implications there. We are intrigued by folks that are carrying symptoms for a long time, especially those who are struggling with long COVID symptoms like shortness of breath, malaise, and some ended up feeling better after getting the vaccine, but it's not everyone. Now we are investigating the role of autoimmunity in the patient journey with COVID and seeing what happens when the virus triggers immune cells to attack healthy cells. So many viruses already do that, like HIV, but with COVID, it doesn't happen to everyone in the same way. And so it's not a done deal. We are early days into that research. Another interesting clinical feature of long COVID that we are observing more and more is people experiencing the blues.
So I want to ask you about something else. Hawaii's Department of Health says that they've had a few people who were fully vaccinated become infected with COVID-19. They put out a statement. They basically said that the cases were mild, but the statement also noted that, this can happen even if you're fully vaccinated. Do we know anything more about, how rare this is, or is it rare, or how something like this could happen? You're supposed to have the vaccine.
Right. Well, the vaccine are effective and safe into preventing moderate, severe disease and conditions that require hospitalization. And the studies were conducted to understand if it prevents deaths or not. So it is possible that folks that are fully vaccinated still develop some symptoms of COVID in case they're exposed, but they will not develop the severe form of the disease and not require hospitalizations per clinical trials that were studied and published. So in that sense, it's important for us to understand as well how our public health messaging has been through the course of this pandemic. One of the things that I find that folks struggle to understand is exactly what kind of benefits the vaccines are giving us. And I think the message is pretty clear. The vaccines will prevent hospitalizations, severe form of the disease in many, many cases, but they will likely not prevent the occurrence of mild symptoms in case you are come across the virus.
All right, Dr. Nissola, thank you very much as always, Doctor. We appreciate it.
Thanks for having me.